Intranasal Versed. You're welcome. This is in regards to the video I made about a study that compared the success of either intramuscular Versed or intravenous lorazepam in terminating seizures. A lot of people asked about intranasal Versed, and this user obviously with their whole chest. But what does the data say? This is a 2022 retrospective cohort study using ESO data. There's some pretty respectable people involved in the study, which is called Real-World Use and Outcomes with Out-of-Hospital Treatment of Status Epilepticus in the United States. This is all field EMS data, about 7,600 patients, about 650 EMS agencies. In their conclusion, not only did they find that intranasal Versed was less effective than terminating seizures than intramuscular Versed, but it was associated with increased need for rescue therapy. It should be noted that intravenous Versed had a higher association with terminating seizures than intramuscular Versed or intranasal Versed, but we all know that that's not necessarily practical or pragmatic when someone is actively seizing. Now, in response to this comment, somebody told you that intranasal Versed isn't necessarily a great route, and you said it's not about the route, it's about poor administration. But you're literally acknowledging then that it's not a great route because it tends to be poorly administered via this route. The plan is not the goal is the goal. If people can't implement the plan, it's not a good plan. Let me also add that this data is consistent with other data that demonstrates that intramuscular Versed is superior to intranasal Versed. And link to that study in my bio.